critical, I agree. So we have some basics that tell you how, what to do, when to do, and this is for a lifeguard stuff. And the lifeguard need to know if it's a shallow or is it deep water. It makes difference, yes. In shallow water, it needs no equipment. In deep water, the lifeguard needs to use equipment or be with another lifeguard to do in-water ventilation. And as soon as he gets on the patient, he needs to face out the victim face out, open airways, check for breathing, and if no breathing, start immediately ventilation at the place for 1 minute. And if this doesn't restore the ventilation spontaneously, they assume that is a cardiac arrest and you should go rescue, tow the victim to the shore with no other intervention or no other procedures. Of course, as much as you can transport the victim from the water to the land, as vertical as possible is the best for the victim. And as fast as you can also. When a lifeguard gets in a dry place, the victim should position with the trunk and head at the same level. The lifeguard asks to call to someone, to another lifeguard to call for advanced life support, and advanced life support is dispatched immediately using an ambulance or a helicopter, depending on the difficulty you have to get on the place. And check for ventilation, circulation, and start CPR if arrested. We change a little from 2 initial ventilation to 5 initial ventilation, and it might work better than the other way. So one of the changes for us was, instead of bringing the patient to the trauma center, we bring the trauma center to the patient. And this is a great modification. And so when advanced life support gets on the beach or on the pool, they might have to do everything there. They might have to have all the equipment to do everything there. So here are some tips that we use at our beach in Rio de Janeiro, and especially for ventilation. Don't bring unnecessary equipment. You have to run. Sometimes it's not near from where you stop the ambulance. But just to assure a secure, definitive airway. Take over the CPR from lifeguards, but keep them doing thoracic compression or some kind of help. This has a strong link between advanced life support and basic life support. Start adequate oxygenation. You can use a pocket mask or a bag valve mask, and prepare yourself to intubation. This is unconscious, probably a CPR patient, a cardiac arrest patient. So on the intubation phase, we always have to intubate like a subaquatic intubation. This is a particular thing for doctors, and it makes it sometimes difficult. And despite the other thing is, despite the edema that flows from the lungs, you don't have to aspirate too much. On circulation, you need to access a venous, a peripheral venous for drug administration. You use a manual or semi-automated external defibrillator to monitor the rhythm. If CPR do not result in restore cardiac arrest, use epinephrine and keep doing CPR in place unless you are unable to rewarm the victim successfully or consider no further benefits. For the other 95.5% of the victim, which is conscious or alert, You just rescue the victim from the water to the shore. And then lifeguard usually have a question, which is what I'm going to do from now. And one of those questions is those that I put on the screen is, should he give oxygen in all cases? If so, how much? Should he call an ambulance? Should we release or keep them a while in observation? How are we to know which case need an advanced support to call them? And usually we use a classification system for basic, which lifeguard use at the beach to know exactly what they had to do. And this is basic, the classification. And you go from a rescue, which is the last severity, to the grade 6. And if you look at the screen, you're going to see that first question, which is check victim response, which leads you to, if no response, you have to go to open airways. If not breathing, give 5 mouth-to-mouth ventilation, check carotid pulse, and you are already classifying, but you are already doing something, doing the CPR thing. And the other part of the classification system, you check, the lifeguard check for cough or foam in the mouth and nose, and they can know what grade is it and what to do. And each grade relates to some kind of prognosis, which is important for the family and us. So, for rescue case, we usually release from the beach or the place, the pool. For grade 1, we just warm and calm the victim, and normally advanced medical attention or oxygen is not usually required for those. For grade 2, really needs to give them a first aid, and oxygen is okay. It's good to do if you have it on the place, and go to hospital for observation for at least 6 to 48 hours. In grade 3 and 4, need urgently to go to an ICU where we will put into a ventilation, artificial ventilation, and keep them on respirator for at least 48 hours, and then release in extubation, etc. So, 98% of the rescue are discharged home directly from the accident site. That's what our figures on Rio de Janeiro. Only 2% need to be transported to drowning resuscitation center, or in your case, hospital. And this is some basic figures we have from 10 years ago, where we saw analyzing 46,000 rescues, we saw 97 deaths by drowning, 930% were referred to drowning resuscitation center, and just 15% drowning were referred to hospital. So if we can resume what we have said, what to do at the initial treatment of drowning? Always prevent it, rescue as early as possible. If unconscious, start in water ventilation. Always assure clear airways to oxygenation. Rescue 1 and grade 2, rescue in grade 1, rest and release home. Grade 2, oxygen in hospital. Grade 3 and 4, high flow oxygen, audiotracheal tube as soon as possible, mechanical ventilation, and this is only about ICU. Grade 4, you have to monitor the breathing, start crystalloid, and evaluate of use of vasopressors. In grade 6, you're going to have to do a CPR as soon as possible and keep it at place. So, what not to do on the initial treatment of drowning? Do not wait to help drowning. Don't waste time to start ventilation and oxygen. Don't waste time on airways aspiration. Do not use gastric tube before assure a definitive airway. Do not use diuretics. Do not use antibiotics unless you truly need it. So for our work properly, for our understanding of the burden of drowning properly works, we need to get the lifeguard together with the medical team and see all the pictures. Here a final quiz for you. What is the name of the city of Rio 2006? And this is a flip-flop I'll give you if you answer me. The city. Ah! And thank you guys. It's finished.
In the presentation, there was a section on resuscitation in shallow water. After that, it said remove the victim from the water in as near as possible to a vertical position. After which, you laid him flat on the ground for CPR. Now, what is the reason for the vertical position in removing it? Perhaps a related question. One method of getting the victim out of the water, which I have only once read about in a Lifesaving manual, is the farmer's lift over the shoulder. And yet, if it's properly balanced, you will have both hands free to help yourself clamber up a steep riverbank, grabbing tree branches and so on. Is there anything harmful in that farmer's lift?
Yeah, good question. Yes, it is. We used to do this 20 years ago. We carry the drowning on the shoulder, but we realized that when there's two things that happens on the drowning. First was the misunderstood that if you put the drowning upside down, you can drain the water out. And this is a little misunderstood, but not totally. The misunderstood is when you put the drowning upside down, what comes mostly is from the stomach and not from the lungs. So when you put them down, you are unable to ventilate. And if you were carried by someone sometimes on your shoulder, you're going to see that this I will give you a free lunch, whatever you want to eat, and then put you on my shoulder and press your stomach with my shoulder, and you're going to see 100% vomit. And the vomit, as we used to say there, we used to say to the lifeguard, we are fire department. We used to say, vomit is the worst enemy for the lifeguard. It's not the coronel, it's the vomit. So you have to avoid it.
Thank you. One last question? No? No? Thank you very much.
Thank you. Thank you.
In these